Now, another year older, Mary hasn't lost a step.
My daughter rides in Iris, and my grandson rides in Tux. So many of my dear friends are here, and it's so nice to see them all. And the crowds are enormous everywhere. It's so good to see so many people out here.
If you walk along St. Charles in the Uptown Parade route, you may run into dozens of matriarchs who have a long-standing tradition of enjoying Carnival with multiple generations of family members. But you'd be hard-pressed to find one who's seen quite as many parades as Mary.
I grew up in the area just like 10 blocks away from here, so this was our area all the time.
If I can look and act and think as sharp as she does at 104, I am doing okay.
Leighton Jeremy is just one of the many family friends who have joined Mary on their parade route for years and says it's truly like being with royalty. He says being with loved ones is what Mardi Gras is all about.
Look at it. This is what gets us out here. It's a family. It's good, clean fun.
As Mary and her friends and family waited for Iris to roll, she told me she couldn't wait to see us again next year. But I couldn't let her go without asking, what's the secret?
I'm so very blessed. I pray a lot. That helps. Yes. And I'm loved and I give love, and it's very, very important.
We honestly look forward to it whenever she turns 105.
I can't wait to see how she celebrates that one. Stay with us. We'll be back right after this. Welcome back at 9:16. We are in February, recognized as American Heart Month, and it serves as a time to spread heart health awareness and encourage a lifestyle that better supports it. So this morning we are learning more from a local pediatric cardiologist. Let's welcome Dr. Michael Walsh, who is with Atrium Health Wake Forest Baptist. Good morning.
Good morning. Thanks for having me.
Absolutely. Thank you so much for being here this morning. I hear you want to talk about congenital heart disease. Why do you want to raise awareness around CHD for this month?
Yeah, well, that is what I do. That's how I spend my days. But yeah, more importantly, this is Congenital Heart Defect Awareness Week. 1 week in the month of February, and congenital heart disease is the most common birth defect that kids in our community are faced with. It's a leading cause of morbidity and mortality. About 1 out of every 100 babies born in the state, about 40,000 babies annually are born with a congenital heart defect of some form or fashion. And a large number of those will require some interventions to take care of that. So anyway, it's a big issue in our children's hospitals and in our communities, and it's just important. I think that we learn about this. It's an issue that faces a lot of neighbors of ours, people in our churches and our schools and our sports teams, and I think the more we can educate ourselves about that, the better we can build empathy, build community, and support these families that are faced with congenital heart disease.
Well, Dr. Walsh, let's go over some of the details here then so that parents are aware of how CHD is diagnosed and what maybe some causes or symptoms are to look out for.
Yeah, so congenital heart disease more and more is diagnosed prenatally. Our obstetric colleagues are strengthening their screening protocols. Their technology is improving, and more they're able to find congenital heart defects in babies before they're even born. And so that's an important milestone in our field to recognize these things early. If they're not detected prenatally, heart defects sometimes are diagnosed there in the newborn nursery time period. Before all babies leave the hospital in North Carolina, they have their oxygen levels checked, and that's another important way to make sure that we're not sending babies home with at least the most serious forms of congenital heart disease. If babies continue without a diagnosis that have heart defects, sometimes symptoms will develop in the first weeks or months of life. Sometimes that can be a change in the appearance of their color, of their breathing pattern. Sometimes it can be reflected in an inability to gain weight well or to feed appropriately. So those are some of the symptoms. Sometimes these are also things that are picked up by pediatricians at the routine well child checks in the first months of life. Sometimes heart murmurs that are heard with the stethoscope can be the first sign that a baby has a heart defect.
Thank you for going over all of those. I think parents are happy to hear some of them and, be aware of how treatment options are definitely changing. You mentioned the varying levels of those. Can you go over maybe a few of what you're looking at right now with current technology?
Yeah, so fortunately, a lot of heart defects are things that can just be observed. There are lots of babies that are born with small holes in their heart or heart valves that leak to a mild or moderate degree. And these are things that we can often follow in clinics. Sometimes those holes will close on their own. Sometimes those valve leakages will be tolerated for years and years. But there are a number of heart defects. About 1 out of 4 babies that are born with heart defects will need some sort of an intervention in the first year of their life. And sometimes that's a less invasive heart catheterization type procedure. But sometimes these babies require a heart surgery or even a series of heart surgeries, often even in the first days of life, to correct more serious heart defects if, say, a part of the heart doesn't form normally or blood vessels that attach to the heart attach in an incorrect way. These are things that can be much more serious, require much earlier intervention, and require a lot longer recovery and maybe changes in the way these babies live their lives over the course of their months and years.
Well, thankfully, there are doctors like you, Dr. Walsh, out there who are very informed on this topic and helping those parents early on in the process. Thank you so much for sharing your time with us this morning and that valuable information.